Hi, this is Dr. Kristen Allett, and I have a Christmas vacation story for you. Part of why I wanted to share this story is because I took the alternate path. As you listen to this story, if you have taken the common path, that is fine. This is not a story to say not to take the common path. It's really just a story that it's possible to take the alternate path. So what is my story? Well, between Christmas and New Year's, I was talking to a friend as I was taking out the recycling, and I slipped and fell on the wet steps. After saying a lot of really not pleasant words over and over again, I was able to take a deep breath and take a look at my arm and said, "That's the wrong shape. I think that I need to get myself to the hospital." She said, "No problem. I will just drive by, take you to the hospital. I have an appointment to go to." So that was really wonderful. That was super simple. I get into the hospital, and the first thing they say to me is, "Get you meds." I take a deep breath and I say to them, "I don't do opioids. I work with people in recovery, and I don't think that I need opioids today." And they say, "You're in the hospital, you broke your arm, this is going to be really painful." And I say to them, breaking my arm was really painful, and everything that I have experienced so far is manageable. And they said, "When we put your arm back into place, it's going to be really painful." And I said, "I'll take that risk." Then offered me Tylenol and ibuprofen, and I said, "Absolutely, I am happy to take large amounts of ibuprofen and Tylenol, which are not only good at managing pain, but also decrease inflammation. Unlike opioids, which, yes, manage pain, but also make you not as emotionally engaged." What I was really clear is that my arm hurt. I was fine. My arm hurt. I was fine. And as long as I didn't try and pick anything up, "Okay, we're going to have the doctor come talk to you." Of course, fast forward, this takes an hour plus. And I just sit and people watch, because that's what you do in an ER. So the doc comes in and he's like, "I'm going to have to reset your bone and it's going to hurt a lot." I said, "I work with people who are in recovery who, if they took opioids, they increase their chance for going back to their addiction. So I will be fine. I am sure I will be fine. And I will let you know if I am not." And he said, "Okay, but I'm going to have to do a nerve block." And I could feel his words bring fear up in me that what I experienced when I fell was going to return. That level of pain was going to return. And I was just like, I don't think it's going to be the same level of pain. And so I was just like, I'm just going to play this out, because I asked people to play this out, and humans have broken bones for eons and survive it. So we must have the skills to survive it. So I'm just choosing the alternate path. I'm just taking each step as I go. And I know that I can always be like, "Okay, give me the opioids," right? Give me OxyContin, and they would supply that in a moment. So they're like, "Okay, we're going to send you down to X-ray." I'm transported down to X-ray, and I have to move my arm carefully. But if I move it slowly and carefully, the pain is not so much. If I just stop and I breathe, it's really reasonable. So they take the pictures, and I get taken back to the room, and the doctor comes in and he's like, "Okay, we're going to have to reset it. And to do this, we're going to," and for some people who cannot handle medical description, this is a trigger warning, because I am going to describe it so that people know, because I think that when you have knowledge, there's less fear. So he's like, "I'm going to use a very fine hypodermic needle to numb the skin, and then I'm going to do a nerve block at mid arm, right? And then you have a hematoma, and we need to aspirate that." And I was like, "No problem." And so So, like and I asked him, like, is this going to be worse than the nerve blocks that they do for dental care? And he's like, probably not. I was like, okay, let's do that. And so, I can feel the little prick of him injecting in local anesthetic, and then he's like, okay, I'm going to do the nerve block. I didn't even feel the nerve block, quite honestly. And then he's like, okay, I'm going to look for the hematoma, which I guess sometimes is hard to find because he was a little apprehensive. And I'm working really hard to not let his apprehension be my apprehension, right? And so I'm like, you do your thing. He came back with his team of x-ray and who was going to set it. And he picks up my arm and he like moves it around. He's like, does any of this hurt? And I'm like, no, there is zero pain. It actually feels good to move. And he smiles at me and is like, you're a little bit of a weirdo. And I asked him, I was like, did you do anything different because I am not on opioids? And he's like, no. And I'm thinking to myself, I'm like, so actually the nerve block was actually like moved me into the direction of less pain. So why did I need Oxy in order to do the nerve block? I didn't understand. So anyway, he brings in a nurse and they play a little tug of war on my hand, and it just feels like somebody's pulling on my hand, right? Like somebody's like a strong handshake kind of thing with a little bit of a pull, but no pain. If anything, it feels great. So he pulled and he took x-rays, and then he pulled and he took x-rays, and then they splinted it and sent me on my way and said, here's your program for ibuprofen and Tylenol. Now, I have to confess that the first night, everything was numbed and it felt pretty good. First full day, I was in quite a bit of pain until I realized that the ibuprofen and Tylenol that I have was 8 years expired because I just don't take a lot of them. At 1 o'clock in the morning, I got on Amazon, please deliver to me fresh Tylenol and ibuprofen at these doses that they recommended. And the minute I started doing their program, the pain has been pretty minimal. I'm a little tired because this is my dominant hand. And so this hand, my left hand, is learning all sorts of new things. And that's a whole other story. But I just wanted to point out that when you have an acute thing happen to you in the hospital, like kidney stones, a broken bone, they will offer you Oxy because they don't want you to be in pain in the moment. But I have seen enough people who have been offered Oxy because it make you emotionally feel great. And for your brain to learn that something externally magically can make you find numbness, that delicious numbness for some people, is a setup for enormous amount of pain called addiction. My brother, who works in a hospital, pointed out that part of why they are interested in giving people Oxy is it just makes them more compliant and it helps the conveyor belt move faster because people are not nervous and they're not expressing concern. I just have such deep respect for the power of opioids in some people. I think it's important to use them in their place. I had a friend who broke her femur and she was in the hospital for days. If you are in the hospital and you are in pain or you're having surgery, do the opioids. Really important, but they're in control of the opioids. They're really dangerous when we have access to them and we can start making choices around them. And if you know that opioids is not a problem, no problem. Do what's best for you. This story of mine is simply to tell you that it's possible. So, have a good day.